I'm now going to describe the use of the Ventway Sparrow miniature turbine ventilator in specific cases. I have had experience using this ventilator in transport mode, in ambulances, in taking patients on ventilators to their homes for outing on ventilators who are otherwise hospitalized in the chronic ventilatory centers of which I'm a consultant in Israel. And I have personally used the Ventway Sparrow ventilator in transporting cases on our air ambulance. We have a Hawker 800 SP air ambulance, and I've used it transporting the patients on long distance international flights, including to the United States. And I've used it in invasive and non-invasive mode just for high flow, oxygen or pressure support via nasal prongs or nasal mask to ensure adequate oxygenation in patients who needed higher oxygen levels at altitude. I want to describe 3 cases of the use of the Ventway Sparrow in the hospital environment, emergency room, operating room and intensive care. The first case, a 60-year-old adult with cardiogenic pulmonary edema, was tachypneic, anxious, diaphoric, and had a low saturation of 76%. He was immediately put onto the Ventway in CPAP mode via a face mask. On auscultation, there was extensive rails bilaterally. He was therefore intubated, sedated, and put on an SIMV volume-controlled ventilation. His weight was estimated about 90 kilograms with a height of 165 centimeters. And I'm showing you below on the screen the settings that occurred by the default parameters in the ventilator to make sure that he was adequately oxygenated, ventilated without hemodynamic interference and without any harmful hypo or hyperventilation. That's his weight. The mode of ventilation was SIMV volume controlled with 100% oxygen initially. The respiratory rate was 14. The tidal volume was 420. The pressure support for the spontaneous breathing part of the ventilation for the rapid breathing was 10 pressure support. His PEEP was 8, and the peak expiratory pressure was between 35 and 40. This delivered good oxygenation and allowed us to control his edema without producing hemodynamically harmful hyperventilation or pressure. The second case is a child, 12-year-old child brought to the emergency room after a road accident, hit by a car while riding his bike. A Lubo airway device was placed by the emergency medical services team. He was tachypneic, anxious, blood pressure borderline, heart rate fast, 135, and his saturation was 93% on the non-rebreathing mask. He was sedated and intubated and connected to the Ventway Sparrow ventilator. His weight was estimated at 45, height at 150 centimeters, and he was sent for MRI imaging using the blue MRI approved Ventway Sparrow ventilator. Below are the ventilator settings, which were aimed in maintaining adequate ventilation and oxygenation without producing hemodynamically harmful hyperventilation in a patient with obvious hypovolemia. We selected the weight at 45 kilos. His ventilation mode was SIMV volume control. His FiO2 was 100%. The respiratory rate was 16. The delivered tidal volume was around 300. The pressure support was set at 5 for spontaneous breaths. The PEEP was 5, and the peak inspiratory pressure 35. The third case is a case moved from the operating room after coronary artery bypass grafting, a 65-year-old male. He was transported from the operating room to the ICU on these ventilatory settings below, which were aimed at maintaining ventilation and oxygenation during the transport. We selected his weight at 65, selected the ventilatory mode as SIMV volume control, a respiratory rate of 12, a tidal volume of 500, pressure support of 5 and PEEP of 5. Thank you very much.